At the Bondi Clinic, Senior Constable Jackie Largo from the King's Cross Police Station has arrived with a very unusual detainee.
Plainclothes police brought someone into custody for a drug-related offence, and she was in a plastic handbag.
You're a fright little thing, aren't you? Little girl.
I've taken the dog off her just because she was too drug affected to look after it, so it just wouldn't be responsible to leave the dog with her.
You gonna come clean?
Police believe the person they arrested is not the owner of the puppy, but how the pup ended up in a plastic handbag is a mystery.
You put her under serious interrogation so far?
Well, no, she refused to be electronically interviewed, so obviously she's executed her right to silence and not say anything.
Going on her teeth, she hasn't started losing her baby teeth yet, so she's probably only about 12 weeks.
Yeah, I thought she was pretty young.
Yeah. Too young to be hanging out in the cross, huh? She does feel quite warm. So you said
she has been shivering, she has been shaking. We've offered her water, but she hasn't really had anything to drink, but she has been shivering the whole time.
Yeah, which is strange because she's actually really hot. The worrying thing for me straight away is the fact it's a 30-degree day outside. It must have been at least 40 inside this bag, yet this little puppy is shivering. You know there's a bowl full of it there. When they're that young, they have this really poor ability to keep their own body temperature in the normal range. They overheat very quickly and they get cold very quickly. So for her to go through this today, it's really going to push her to the limits. I'm just going to scan her for microchip. Yeah. So, I mean, it says it all, no ID found. It's upsetting to think that there's an owner out there that knows she's missing but has absolutely no way of finding out where she's gone. Without that microchip, all you can do is hope. This one hurts.
She may not like it, but this microchip will ensure the puppy's identity is never a mystery again.
Yeah, it's okay. It is. It's going to be all right.
But there's still one last thing this little girl needs, and that's a name.
Famous girl in the cross. A little Tilly.
Tilly? Could be Tilly.
She looks pretty divine. Tilly Devine was an infamous madam at the King's Cross during the 1920s, and since this little puppy was found in the cross and has had her run-ins with the police, I just reckon the two have a fair bit in common. So what you're saying is you're transferring custody over to me?
That's correct. No death on custody on my shift.
No pressure. We've recorded no conviction, you know. Spoke to Constable Jackie. Everything is so up in the air, so really all we can do at the moment is show her some love. You gonna be okay? Oh, don't make that face. Show her what care is all about, and hopefully in the meantime we'll get some more answers. Oh, don't make that face.
At the Bondi Clinic, Chris has become custodian of little Tilly.
Yep, it's a mugshot.
The 12-week-old puppy was rescued at King's Cross by a quick-thinking police officer.
And to the side, thank you.
After being found sweltering inside a plastic handbag.
No one can tell us who she is or who she belongs to. And Tilly, while you're eating, it's probably time to talk about your custody arrangements because Jackie never really said where you had to be held in custody, did she? I've got some ideas. Now, Till, happy to say you're the first girl from the cross that I've actually brought home here. But you need to know something. I'm actually not in charge here, all right? There's someone you'd probably refer to as the prison warden in here. George and Tilly have a lot in common. George was rescued by the police. He was dumped in a cage in the ocean down at Bondi. So the problem we've got right now is the fact that we're battling hypothermia and was rushing to me late one night, essentially blue. He'd nearly drowned. And so it was the police that saved his life. And with little Tilly, it's the police that saved her life as well. George, that's not a welcome. He's gone. Till, don't take it too personally. He was like that with me when he first met me too. And we get along fine. No. What are you doing? Yeah, I know. You never do this. No. George, sort that out. Sort it out. You're in charge around here. Sort this out. George. You're just going to stand there and watch it. I really should have thought about this more, shouldn't I? George is proof that even if you do have a rough start or a rough patch in your life, then with a bit of love and a bit of care, things can turn around. Can you sense the distance between us? It could be about as close as we're going to get. He's not thrilled.
Later that week at the clinic, while Tilly's having a little nap,
Thank you. Okay, bye.
there's a welcome phone call for Chris.
That was Constable Jackie from King's Cross Police. So an owner has come forward, contacted them, who apparently owns Tilly. So she's coming in now. I don't really know much information about her. The police are happy for her to pick her up, and if they're happy, then I'm happy. Got someone here for you.
Hello, Abby.
It's Abby.
Yeah, Abby.
I've been calling her Tilly. Oh, she's happy to see you.
It's been horrible. I've been so worried about her. Yeah, I'm so happy to have her home. She's safe and well.
This is the first time I've seen her really just truly content.
But just how Tilly ended up in the cross in that plastic handbag remains a mystery.
A friend had her for the morning and then some problems happened and they lost her.
As for the person who was found with Tilly, police have decided not to press charges.
Considering everything that Tilly's been through, it's really nice to know that she has an owner that loves her, and she's going home with her. And, you know, sometimes, as Tilly knows, what happens in the cross stays in the cross.
Nemo!
In Sydney, Rob has been anxiously waiting for a very special little patient to arrive.
All right, let's go. When Nemo came into BARC, which is the Blacktown Animal Rehoming Centre, we were all in shock. Ready? Oh.
Rescue worker Alex is hoping Rob can help the lively 12-week-old stray after a tragic start to life.
Good girl.
Today we've got little Nemo, little puppy I'm told with a deformity in the front leg.
Okay. No one has ever seen anything like that before. We were so worried she was in pain, but she was super friendly, super happy. You couldn't even tell anything was wrong with her. She was just so happy and cheerful the whole time.
Are you a good girl? Oh, yes. What's this?
Little Nemo. Hello, sweet. Oh, you are the friendliest little thing. How are you, Bubba? You're gorgeous. You are very gorgeous. You are very gorgeous. You know you're gorgeous. Oh, gosh. You poor baby. It doesn't matter who you are. As soon as you see Nemo, your heart melts. That little puppy, adorable as she is, wags her tail. She is so lovable. All you can do is just think, how can I help you? Right, come on in here.
Thank you.
Just take a seat there for me. Oh, gosh, so she's such a happy little soul. We can learn so much from dogs. If it was a human, you'd be going, why me? But this puppy, with all its abnormalities, she seems to be coping okay.
Yeah.
But
We're just worried she's in pain.
just pop her up here, let's have a look. Yeah, she keeps bouncing on all those bones. They're going to come through the skin. We have to do something one way or another. Let's just see how she walks, how she compensates. Just go over there and call her, she'll come to you.
Nemo. Oh, hello. Good girl. Nemo. Good girl.
Hello, Bubby. Oh, gorgeous. Yes, I love you too. All I see is this beautiful little heart that's coming towards me and trying to walk along with that little flipper of hers that she's made out of some great deformity and compensates for that terrible little leg of hers. I hope we can help her in some way. Hello. Let's take a seat up here again. I'm just trying to work out which bone is which and which joint is where. Oh my gosh, seriously, in 50 years of practice, I've never seen anything like this. I cannot believe the amount of deformity in that front leg. It looks like there's bones growing out of bones. I have no idea what's going on with this. It is just structurally, unbelievably a catastrophe. Oh, princess, what has happened? What has happened, eh? Okay, we're going to need to get some good x-rays for her so we can tell you what's going on. Come on now. Hey, little one.
Before taking the x-rays, Rob checks Nemo's heart to make sure the youngster is okay to undergo a general anaesthetic.
Thank God the heart's normal. Hey, there's a good girl. That's my baby. Just go to sleep. Just relax. Relax, Bubba. I know. A bit frightening, isn't it? I hope we can help her in some way because dogs take around 80% of weight on their front legs. Nemo has only one front healthy leg and it's trying to balance on the back legs as well. It's going to put pressure on all these other legs.
When you're ready, take the shot. Fire. Thank you.
Rob takes x-rays of Nemo's badly damaged leg from several angles.
Fire.
He hopes the images will explain how such a young dog came to have such a horrendous deformity.
Yes, sweetheart. Boy, oh boy, you are a challenge. Can you save that leg?
I have never seen a deformity like this. I don't know if I'm going to be able to fix this.
With the x-rays finished, Rob takes his precious bundle to share the results of the scans with worried rescue worker Alex.
Okay, she's all awake. Come on through, we'll go and have a look at these x-rays, eh? Up here. Just grab a seat there.
Thank you.
Here you are, Nemo. Off to mother.
Oh.
Let's have a look at these x-rays. Oh my gosh. You don't have to be a vet to know that this is abnormal. This is weirder than I thought. This is what it should look like. Just have a look at some of these other x-rays. Bones everywhere. We've got the humerus here, the upper arm, and here is the ulna, and this is the radius. They should be together, sitting underneath this bone, the humerus. So those two should be together. These toes should be coming straight out this way. What we thought was the elbow is in fact the wrist joint. And there's no normal anatomy here.
So how do you think it happened?
Well, I can't believe it's a congenital deformity that's just born like that. To me, it looks like she's had a severe trauma early in life. Maybe mother sitting on it or someone's dropped her, and it's a matter of what are we going to do about it? Can we bring these together somehow underneath that, straighten it a bit? It won't be functional with all the joints, it'll be stiff and straight, but it'll give her great support that she'll be able to walk on. She'll have a limp the rest of her life. The other alternative would be to see whether a prosthesis can be put in, and then of course the third alternative is just to amputate. That's the easiest way out, but easy is not necessarily best for Nemo, so we want what's going to be best. As an orthopaedic case, it is the most baffling case. It may end in amputation, but we're going to try other things first. I'm not sure where this case will end, I really don't know, but I know I'll do my very best to get it right for this little puppy. There's fine to start with. Whoop, just put it, lift her little head up.
Rob takes photos of Nemo, which will help determine the best course of treatment for the lovable former stray.
Okay, I'll send the photos and the x-rays to a couple of different specialists. I'll be in touch with a treatment plan and work out what day and what we're going to do for her.
All right, thank you so much, Rob.
Thank you for trusting me with her.
Good girl.
It's 2 weeks since X-rays revealed the full extent of the massive deformity in the little dog's right front leg.
Good girl. You're very good.
Watching Nemo run around is so good. She's so fast, that leg doesn't bother her at all. It doesn't slow her down because she doesn't know any different.
You're pretty fast.
In an hour's time, the vivacious young Staffy Cross will undergo surgery that will hopefully save her shattered limb.
So it's a big day for Nemo. Since we were last here, nothing's changed. She's such a happy little girl.
Are you a good girl?
The team at Bark are feeling a little bit nervous because it's such a big thing for such a small dog to do at the moment. But we're all got our trust in Dr. Rob, so we know he'll do a good job. She's been really good at the facility, so we'll be keen to get her back and get her into a lovely home so she can spend her life there.
Hey, little Nemo. How are you, gorgeous thing? Where's my cute little picture? You are very gorgeous. You are very gorgeous. Come on in. I'll explain everything that we're doing. You are mine. Come on.
It's been a little while since I've seen her. She's even sweeter now. I don't know. Every time I see this dog, I just fill up with the love that she gives me. So, a really big day today for Nemo. I've spoken to a lot of people, both here in Australia and United States, even England. No one has seen this before anywhere that I've searched. So, unfortunately, prosthesis is not a possibility for Nemo. There's one of two options: amputation, of course, or trying to salvage something of this limb and make it at least something that she'll be able to use through her life. I don't know if I'm going to be able to do that. I really don't. Yeah, this one has really plagued my mind and my sleep as well. It's nightmares I've been having of where do I go with this case.
When does amputation become a thing?
That is a really good question. Amputation may have to happen even today. If I can't get everything aligned with enough skin, it may not be an option for her to progress trying to save that limb in any way. I don't know if that's the case or not. No, but I'll do my best for you, baby. Oh, don't do that. I love you too much.
Of all the surgeries I've done in my career, this one sticks out as the most complex and where do I go with it type case, because no one's ever done this before and I don't know if I'll achieve anything or not for this puppy.
I wish I loved you. I wish I didn't love you. I hate loving you.
Well, I just want to see if I can get these bones together. It'll support the other leg. Otherwise she'll go through puppyhood and growth on one leg, put a lot of pressure on all the joints on that one leg, and that can cause arthritis and other problems.
Oh, seriously, Nemo? What sort of foot are you going to have? Why am I doing this? Hate you. I hate you. Time for you to say goodbye and time for me to start sweating.
All right, good luck.
Okay, thank you.
Bye, Nemo.
Say goodbye, dear mummy.
Be a good girl.
After you.
So it's kind of sad saying goodbye to Nemo. I'm a little bit anxious for Nemo and Dr. Rob because who knows what's going to happen, but I know he'll do what's best for Nemo and I think she'll be great. She's a tough cookie.
The incisions, we're going to have to go through there to bring you down into position, bring you down and straighten this. Put all these together again. Oh, wow. This is worse than Humpty Dumpty. The big worry is will there be enough skin? Darling, there's only one way to find out now. This is it, darling. All right? So we're going to give it our best shot for you. You're just too beautiful. It's all right, Bubba. It's all right, Nemo. Baby, baby, baby. It's all right. Shh. I know, darling. Good girl. Good lass. There's my girl.
Rob has anaesthetised Nemo before attempting to reconstruct the rescue puppy's mutilated leg.
Let's see if we can do it.
It will be the most challenging surgery Rob has ever performed.
turn her over this side so we can get the fluids running. This is like the first surgery I've ever performed in my whole life. There's nothing anywhere about what approach to do with this. So I'm using all the experience I've ever had over 40 plus years of being a veterinarian and just trying to put this limb back together again. That toe has to go, it's non-functional anyway. And this has to be joined up with that. Even though she's been born with this terrible malformation, this animal is so lovable, just adores the world, adores everyone. She doesn't care, I'm the same as everybody else and I just love everybody. She's got a heart of gold, this little dog. All right, let's get started. Here we go. See if you can just stretch that skin that way a little bit for me. Just pull it apart for me now. I've got to work out how to get that to there. That's the wrist. What we think is the elbow is actually the wrist. So what I'm trying to do now is release enough soft tissues around what would be the wrist. And we're trying to realign the bones into a straight line. That's the elbow. Can we bring those tissues and stretch them? And it's literally trying to bring in a lot of brute force. Stretch those out a bit. If we release these tissues, we've got a chance. Come on, baby, let it go. And we're trying to straighten all this out, and the amount of pressure I'm having to put on the wrist is crazy. It's just so deformed. I've also got to pull the ulna down and try and get it under the humerus. Then I'll have to bring the radius down, and the amount of pressure is frightening me because I could snap the bones. How does the end of a radius end up with a toe? This is a terrible jigsaw puzzle. If I snap the bones, all bets are off. We will definitely have to amputate. The guy will just bend this around. Yeah, sure. It's like when you look at the books, they say, just do this. Cut from A to B. There's no A to B on this dog.
Nemo's abnormal anatomy is also making it virtually impossible for Rob to navigate the vital nerves and blood vessels in her severely damaged leg.
There's a big blood vessel there which I really want to preserve. When you stretch a blood vessel that's that big, it becomes that big. And if that's compromising the blood supply to that limb, we'll lose it. I just don't know if we're going to make this one done. If we can't get this done, we can't get any of you done. Come on, baby.
Rob, her oxygen's gone down.
Knock the nitrous off. Just want to achieve something for this little dog. Please, get her oxygen level back up. So this is really difficult right at the moment. Yeah, her oxygen levels have now dropped twice. This is the second time. I don't want to make a third time lucky. I'm really worried. What do I do? I've got to make a decision. It's really hard. Sorry, you're right.
But suddenly, her condition deteriorates once more.
Her heart rate's dropped.
Her heart rate's dropping. We're losing her. Her life's more important than anything, so we're going to have to amputate. I want to get out of here for her sake as quickly as possible now. I just have to amputate and not think about it in any emotional sense. Very difficult, but that's what we have to do. We need to save her life. Oh, Nemo, sorry, Princess. That's the way it goes. I'm going to take it off at the shoulder. Just got to cut through all the muscles, tie off the blood vessels, and then disarticulate it. Poor little monkey. I know I'm doing the right thing by her now, but I'll go to my grave wishing I could have saved that limb for her.
Although removing Nemo's leg will be much quicker than trying to rebuild it, Rob still worries he could run out of time if her vital signs don't improve.
This is not a standard simple amputation. There are vessels where there shouldn't be vessels and muscles that are not even aligned properly. Everything's in a weird position. I certainly don't want to cut the wrong thing, but on the other hand, I don't want it to be under for any longer than she needs to be. How's her colour? Heart rate gone up a bit. I've got to hold the nerve here. Good. We are very close.
But with the amputation almost finished,
I'm hoping we've tied off the really big blood vessel that is underneath here. No, we haven't.
Nemo is soon fighting for her life again.
Swab. Swab again. So I thought I had a blood vessel there, the main one, tied off, but it wasn't. As I cut through some more tissue, blood spurts out, and really I've got to act very fast now. I've got to get in there quickly and shut that off, otherwise she'll bleed out. It won't take long for this little pup to lose a lot of blood. Swab there. That's it. I think we got him. Good.
Narrowly averting disaster, Rob successfully completes the amputation.
Okay, we're done. Let's get her awake. She's already starting to come to. My little one. Now, I do love you. Hope you won't hate me, but I had to take it off. That's a good girl. Here we go. We don't need that light on anymore, do we? Not in your eyes. No, those beautiful eyes. Here she comes. Here we go, Bubba. I know she'll accept life quite okay on 3 limbs. I would have loved to have that as a bit of a stump, bit of a crutch that she could have used. Good girl. Good girl. Better? There we go, Tom. There we go. I know. Had to take it off, Bubba. Sorry. Good girl. It's all right. I'm right here. Right. It's going to be all right. Yeah. Still got to be. They just get to you sometimes. This is one of those cases, just... Right now, I just feel pretty gutted. I've invested mountains of time and thought into little Nemo, and worse still, way too much emotion. I know I get too involved with my cases, but how could you not with this gorgeous little dog? And so the relief that she's okay is absolutely fabulous. It's overwhelming. So it does really get to me, and I just, all of a sudden, everything goes. She's not in pain, and she's waking up, and she doesn't have to worry about that. She's going to have to concentrate on 3 legs, and we'll help her with that. We'll help her with that. All good. My baby, my little baby. How are you? Good girl, I love you. Let's have a look how that wound's going, princess. See?
It's now almost a week since Rob was forced to amputate little Nemo's front leg.
Look at you. Bubby, bubby, bubby. This leg's a little bit too bent, isn't it, princess? Just a little bit worried how you're bending there, sweets. I want you up on that. I've got to get you up on that foot a bit more. The wound's healing really well. She doesn't even act like anything's happened to her. Normally, I have to help them after an amputation, especially with a front leg, learning the balance again. Not this little pup. The next day, she was up and running about. She's going really, really well. You might increase the calcium in your diet. Get you up on those toes. But that looks good. Good girl. I love you. You are gorgeous. Can't make you any more gorgeous. She just doesn't stop delighting you. She's just a ball of love, this dog. I can't believe it. She just kisses you and she's just delightful. Okay, let's see how you balance and run around, eh? Come on, let's go. Okay, let's see how you enjoy the grass, hey baby? A bit of vitamin D with the sun. Come on, puppy. Come on, my darling. Up, 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 up. Good girl. Good girl. Go for a run. You are doing really well. Up, 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 up. Oh, my darling. Here's my darling girl. With Nemo, I would love to help them find that forever home that she just delights everybody in the family and is the only dog there. Having said that, it'll break my heart when she goes. Boop, boop. Where are you going? He's a baby, he's my baby, my baby. Oh, you're so good, you're so good. Oh, belly rub, belly rub. Don't know if I could fall more in love with this dog. It's a real problem, but she's going to have to be here for a few years, I think. I'm not sure yet. Oh, come here. It's like a whip, isn't it? That tail, but just can't stop. Can't stop with that tail. You run around like nothing's ever happened to you. Yes. Oh, you're just gorgeous. Yes, you are. All right, take you back inside. Oh, sweetheart, this is so hard. It's been such a good time with you. Fabulous 6 weeks.
For Rob, this is one of the most emotional journeys he'll ever take.
Time to get into a forever home where you're just the only dog.
My son especially has been wanting a dog for about 5 or 6 years, practically his whole life. So we decided we wanted a dog. We've been looking online. When we saw Nemo, we fell in love with her instantly.
Drive over here was a bit of an effort, to be honest, and at times I thought I should have had somebody else driving because I was so distracted, thinking, is this going to be good for her, is it not? Trying to question it even now. Make it easy for you, eh? Make it easy for you. Hey, Brooke.
Hey, Rob.
How are you? Good,
Not too
good,
bad.
good.
Hello.
Here she is.
Hello.
Oh, you're happy here.
Hello. Good girl.
She'll make a wonderful pet here.
Oh, she's going to be very loved.
Oh, she'll be very much part of the family, I can promise you that. She just doesn't know anything but love, don't you? No, I know that.
Seeing Nemo come in with Rob, knowing that she's at home, it was exciting. That's my new baby.
Anything she needs, Brooke, anything at all, you just let me know.
No problem.
All right. It's a bittersweet day. I mean, didn't want to separate from her ever, to be honest, but I know she's better off as the only dog in the household. While she's young, she'll fit right in and be a member of the family, and that's what I want for her.
Just had a call to go out and see a horse that's apparently in pretty poor condition and getting worse. Now, it sounds as though nothing's ever really gone right in her life. Her name's Sally. She's an ex-racehorse. Now, typically, ex-racehorses really struggle to have a bright future. My hope is if she's not in too bad a condition, then there might just be a way we can turn her luck around.
4-year-old failed racehorse Sally has been dumped in a paddock.
Must be her. Hey, girl.
Chris has been asked by the Randwick Racing Trust to check her out as a possible candidate for their new rehabilitation program for unwanted thoroughbreds.
To put it in the simplest possible terms, if she fails this test for soundness, then she's off to the sale yards. And from there, you just hate to think about what might happen to her.
G'day, mate.
Hi, boys.
Chris.
How are you?
Yeah, good. How are you?
Not too bad.
Scott and Shane, who run the Randwick program, have arrived to hear what the verdict will be for Sally.
So she's had 3 starts for a last, a second last, and a second last. So, yes, it's embarrassing, I know, Sally.
She's consistent.
That up. She is very consistent. I'm going to give you a full check. There you go. She's obviously not in the greatest condition, just coat's a bit ratty and a little on the skinny side. You look okay. Gum colour's nice and pink.
The future's grim for horses that are left without the care that they need. And whether it's a slow decline or whether it's something that has to happen, they have to be taken away and put down, it's neither of them are good options, that's for sure.
Basic structure of the hoof's all right. Seem to have any pain.
Chris's examination of abandoned racehorse Sally is a matter of life or death for the thoroughbred.
If we didn't get the call to come out, this horse would probably stand in this paddock for another, who knows how long. Thoroughbreds in paddocks don't do very well. Largely they can stand there and starve to death if they're not getting the right sort of care. In some paddocks, the feet will grow out until they look like flippers, and then suddenly they're no good for anything ever, and there's only one option,
She has the bare bones of what, and quite literally the bare bones of what could be quite a good horse in whatever field you had in mind. But I just can't see a reason to say no.
Okay, good. No, I'm happy with that, mate. I think you're right. We'll get her looking good. We'll get her going well and see if we can find her a home.
See you in Randwick.
Sally's now off to Randwick Racecourse, where her future will be decided.
Isn't it funny though, the ears are up? She already looks a hand taller, doesn't she?
Absolutely. She's a different horse than she was in the paddock. She is.
You remember the track, don't you?
There you go. Good girl.
I just want to do one more final test just to trot her up and actually see if she's lame on any 4 of her legs. Ideally what we're looking for is that back hoof should actually come through and land in the same spot where the front hoof landed. If you watch closely, she actually does that. Mate, she's all yours. I think she's going to be a great prospect.
Yeah, great. We'll give her a go and see how she turns out.
This is the new home, is it?
This is Sally's new home, Chris, and this is where the rehabilitation program's based.
Yeah. It's social, aren't they? All coming out to check out who the new kid is.
Absolutely.
Sally's been put through a series of tests today, and for a horse that's never really had too much luck, she's found some today. Girl, I'm all done. Next time I see you, things might have changed. She's come through them all and passed the ball, and now she's got a new life.
Thanks very much, Chris. Come back in a couple of weeks, you won't recognise it.
Mate, looking forward to it. Thanks very much,
Cheers.
mate. See you later. You look after the new kid, all right?
Watch yourself there.
Over at Randwick, Scott's having some interesting moments with Sally's rehab.
Steady, steady, steady. She looks a hell of a lot better than she looked when we picked her up. She's still got a fair way to go, but she's come a long way in the time. Steady. When she first came in here, she had the flared nostrils and the whole, racing attitude going on, and it took her a while to realise that she wasn't going to have to gallop. Steady, steady, steady. Steady.
The unwanted thoroughbred will only get a second chance if she can pass this re-education boot camp.
Steady. What's up? Steady. Good girl. Definitely worth saving. They're all worth saving, It's great to see that they get the opportunity to move on to something worthwhile in their lives, I fall for all of them, I really love horses, I do. It's a bit soppy, but, they're great animals. They do great things for us, and it's hard not to fall for them. They're beautiful things.
Been looking forward to this.
Oh, I bet you have.
Has there been much change?
Mate, it's a massive change. You'll be surprised, I think.
This was 4-year-old Sally just 5 months ago.
Oh, wow. Is that her?
That's her.
Scott's hoping he's found a new home for Sally. She just has to pass one more test.
I'll need to sit on her and see what she feels like, and then see her over a jump.
If she can impress Kevin, Sally will begin her new life as an eventing horse.
Basically, you get a feel straight away whether you like them or not, whether you're comfortable on them.
Right now, Sally's jumping for her life. If she clears this, She's probably found a new home. Good girl. A bit proud, aren't you? Proud. Yeah.
She's got a new home.
Sensational. It's a little bit sad when you let them go because you always form a bit of a bond with them, but that's what we're here for.
You have to remember this isn't just about Sally, this is about the thousands of ex-racehorses that have this huge cloud over their future. If they can be a little bit like Sally and have the chance that Sally's had, then everything starts a little bit brighter.
Oh, listen to that heart. It's beating so hard. Yes, it is.
At the Bondi Referral Hospital SASH, Denise from the rescue group Pause has brought in a 1-year-old orphan called Olivia.
Her heart, it's just pounding. It's pounding. If the room was silent, I believe you'd probably hear it. That's how loud it is. I think this little girl's in serious trouble. She could not be rehomed because, you know, she's got this problem. The pound cannot sell her. So death for her, that's it.
Hey, beautiful girl, shall we have a listen to your heart? She's got a really loud murmur. It's okay, Bubby.
Emergency vet Lisa Chimes immediately takes Olivia for an ultrasound to confirm her diagnosis.
We grade these murmurs out of 6, and she's got a murmur that's a grade 6 out of 6, so that's the highest. It's just tragic. A heart murmur means that there's an abnormal blood flow in the heart, and if we don't treat it, that blood volume going in that abnormal direction is going to put an extra strain on her heart muscle, and she will go into heart failure, and she will not survive more than a few months, a year, probably max.
I don't want to imagine anything is going to happen to her, and I'll probably start crying about that, but she's alive and she's going to stay that way. Aren't you? Yes, you are.
The operation to fix this heart murmur will cost at least $3,000.
We ask for donations, and whatever isn't covered, I will cover myself.
Wow.
And you deserve to have some more time to live a normal life, don't you? Yes.
Hello.
Hi, Lisa, how are you?
I'm good.
This is the big day.
Next day at SASH, Denise brings in Olivia for the procedure which will hopefully repair her heart.
Good. Everything will be all right. You know, this poor dog has had no luck. It's time that her luck changed. And hopefully it will change now.
Okay.
Cardiologist Dr. Rita Singh will be performing the delicate procedure on Olivia's critical heart murmur. The condition is also known as a PDA, a patent ductus arteriosus.
There's a little bit of tension, nervous energy here today because this is a fairly new procedure at SASH. Traditionally, we've always fixed a PDA by cracking open their chest and tying off that blood vessel. But now we're going to try a newer technique where we don't even do surgery. We just feed like a plug up one of her vessels and plug it off from the inside. Fingers crossed it works.
I've got to do very carefully, so it's taking me a little bit of time.
If this new technique fails, surgeon Andrew Marchevsky is on standby to perform traditional open heart surgery.
The problem with her is she's a really little dog with a really big abnormal vessel. And because of that, we can only get quite a small plug up her artery into her heart. And the plug size that we can get up there may not be big enough to actually plug the hole. And if that's the case, then it's back to me.
Here we come. So it's coming now. See, it pulled through. Yeah, it's too small for it. I'm just going to try once more, but I think this is going to be just too small.
Rita has to be really careful here because if there's one wrong move, it could tear through her vessel and she could bleed out. So it's pretty risky, pretty fiddly, and there's a lot of pressure on here.
Despite Rita's doubts, the plug is finally in place.
Yes. I'm going to keep my fingers crossed the next 24 hours now and we'll see.
I'm getting a little bit excited.
Finally, I'm going to let you get excited.
Yay, Rita!
Just when the team is starting to celebrate,
Let's put you to bed.
suddenly Rita notices a change in Olivia.
I think it's moved.
Really?
I can hear a continuous murmur now.
Their joy has turned to devastation.
Poor dog.
We're just in complete shock here. I mean, everything was looking so good and Olivia was recovering, and then in a second she moved too much and the murmur's back. The device didn't work. It's really disappointing.
That's it. It has to be surgery now. I thought we were done. I knew she was going to be fine.
So she's just over here, having a little rest.
Hello.
After the anaesthetic.
Later that afternoon, a shattered Denise is allowed in for a quick visit.
Can I pick her up?
Yeah, you can pick her up.
Very, very distressed. Really distressed. Yeah. Didn't want to open her chest if we didn't have to. We took the easy option, but it didn't work. So now we go for the hard option. So you've got one more chance. One more chance, hey?
The vessel that we're dissecting around is so thin-walled, and if I push it at all, I'll just push straight through the vessel, and then it's all over.
At SASH, the open heart surgery on rescue dog Olivia has reached the critical stage. The pressure on surgeon Andrew Marchevsky is palpable.
Right, I'm just tying it off now. All right. Goosebump moment. Yeah. She's fixed. It's pretty exciting, huh?
I knew you could do it, hero Andrew.
Thanks, Lisa.
You're amazing. You're my hero. As composed as Andrew was, you can even see it in his face. He has really breathed a sigh of relief that this is over.
She's going to take a few days to become good, but well, I think Olivia will find a home now because she should be just a normal, trouble-free dog.
Who's this? Oh, look, here's your new mum and dad. There you go.
As for Olivia, she's made a full recovery. And her foster mum Denise has found the orphan a permanent home with Terry and Sven.
Oh, I'll miss her heaps. I will. She's such a lovely little dog. But she's ready to go.
We couldn't have wished for anything better.
Isn't that lovely? She's perfect, isn't she?
She's gorgeous.
And she loves you.
It is emotional. She's going to be the sunshine in our life.
Comfy.
At the Bondi Clinic, Rose has brought in 11-week-old Annika, desperate for Chris's help for the little girl's deformed leg.
You're going to be very brave.
The poor Akita puppy has had a rough start to life and was recently surrendered to the Animal Welfare League.
Oh, thank you. Oh, thank you. Oh, thank you. When I first saw Annika, I saw that leg and was kind of a little bit overwhelmed. I really hope that it's not causing her any pain. That's the main thing that I'm concerned about, really her quality of life. And I'm really hoping that Dr. Chris can get to the bottom of it.
Hey there. How are
G'day,
you?
Chris. Rose.
Nice to meet you, Rose. This is Annika.
Yeah, this is Annika.
And what about you?
Yep.
Wow, look at that.
Yeah.
All right, let's see if I can help you.
Yeah, okay.
Come on in.
Thanks very much. Come on.
No matter how much it feels like you've seen animals with all sorts of different problems, there's still that moment when I first lay eyes on Annika where I think, wow, what is going on with that leg? Yeah, that's like nothing I've ever seen before.
Yeah, me too.
Do you know much about how she came to be this way?
She was apparently born like this, and the owners who bred her just brought her in and couldn't afford any treatment.
Well, As far as you know, there's no history of any deformities or any other problems?
We think that she was part of a litter and the rest of the litter died, and the mum was in labour for about 3 days.
Okay, so it's obviously a pretty tough start to life for any dog, and I mean she's clearly lucky to be here if all the rest of them didn't make it.
Yeah, definitely. She's pretty special.
This sort of situation is certainly a first for me. I've never really seen a case like it, and there's a lot of wondering just how I'm going to be able to help her. And I guess if there's one thing that's probably a little bit sobering is that obviously the leg is the most obvious issue that Akita has, but to be born into a litter where none of the other puppies have survived, the concern is she may actually have other issues there as well.
Oh, I really hope not.
Obviously with that twisted leg being such a dominant feature, the temptation is to rush in there and just look at that. But there's every chance that what we're looking at here is a genetic abnormality, a deformity. So if you have one issue, quite often you have a second one, and that is certainly a worry.
Good girl.
All right, well, let's have a look over you, miss.
The worry is that the little pup may also have other problems.
One of those areas where you often do see a lot of problems in dogs that genetically aren't quite right is in the cleft palate, so just in the roof of their mouth.
Yeah.
It's important in such a sad case like Akita to try to find some positives, and already we do have some, because her eyes, her ears and her mouth are actually looking pretty good. All right, so let's just have a listen to her chest and just see what's happening internally. All right, so look, the heart actually sounds pretty good.
Oh, good, great.
Yeah, I mean, the beats are quite clear. They're quite strong, and her lung sounds are also very clear.
It's a relief for carer Rose to hear that so far Akita is looking good. So Chris can now turn his attention to the front legs.
So I can feel her scapula, her shoulder blade there. Hello, thank you, it's very kind. Yeah, bit of encouragement, thank you. And we go down to a humerus there. All right, so we're feeling pretty good. Nice, free and easy.
Good.
Which is very important because at the moment this front left leg is doing a lot of work. It's really supporting that whole front half of her body.
Good, yay.
All right, let's look at this leg.
Okay.
Starting at the top, there is a shoulder blade there. So that part feels like it's formed relatively normally. As I work my way down across her shoulder blade and then onto a humerus, everything's feeling pretty normal. But suddenly, once I reach Annika's elbow, things take a dramatic turn. We're really 90 degrees off where we need to be, which is a long way.
Yeah.
So yeah, it feels like everything from the shoulder joint down isn't how it should be.
Okay.
At the Bondi clinic, Chris is examining little Annika's severely deformed front leg.
We get to there, and that's kind of where we stop. One of the front leg's main jobs is to be able to reach forward and allow a step to take place. But in the case of this leg, the range of motion just isn't good enough. So with those toes pointing so far back, they're never going to support the weight in the position they're in.
Right.
And there's no clear definition of her individual toes.
Yeah, right.
So we know she's got feeling in the upper part of the leg because she doesn't like it when I push it forward.
Right.
But I'm very keen to see if she's got feeling in her toes.
Okay.
Because that'll tell us whether we have a nerve running all the way down to the bottom of this leg.
Oh, right.
I'm squeezing really hard there. There's nothing there, is there?
Yep, she's not responding.
Suddenly, we arrive at what might be the most dramatic finding yet. Akita has no feeling in that paw. If she can't feel in that leg, it really limits what we can do with it. And obviously, I'm, at the moment, just trying to think of every single possibility we can come to and arrive at to give her the best possible life, because that's what it's all about with her. She's a puppy. She should be tearing around playing. She should be having the time of her life. But for her, short little bursts are even too much.
Annika's a gorgeous puppy. Just the thought of her being in pain or being exhausted means her quality of life is compromised, and I can't watch a dog going through that. There's just nothing more heartbreaking, and I'm choking up just at the thought of it because it's really, really sad.
So Yeah, I mean, it's kind of, I guess, the living proof of why she does need something to be done.
Yeah, that's really heartbreaking. I just want him to be okay.
Yeah. What I'll do, could I get you to stand just here with her? And then I'm going to stand up this end. And hopefully when I call her, she'll come running towards me because I want to see how those legs of hers move.
All right.
At the Bondi Clinic, Chris is continuing his examination of 11-week-old Annika and her badly deformed front leg.
You can do it.
Rose has brought Annika to me in the hope of me providing her with a good quality of life, a positive outlook, but I can't do that unless I know exactly how she's walking right now. Annika, come on, come here, come here, come here. Good effort. Watching dogs with 3 functional legs walk is always an amazing thing to see, but in Annika's case, she does something that's quite surprising. So, it's obviously not easy for her. Each of those steps is an effort, but she is still in the learning stage.
Yep.
Can we do it one more time?
Sure.
Because there's something that I noticed there that I want to look at more closely.
Come on, baby.
I keep on reminding myself of the fact that Annika's 7 kilos now. She could be 40 kilos one day.
Go to Chris.
Come here.
Go to Chris.
And the way she walks right now, I don't believe is sustainable. And if you look closely, at the same time that this leg goes forward, this leg here, in trying to do what it wants to do and actually walk, actually pulls back.
Right.
When it does that, it does something to the way she walks. It actually throws her off balance.
Poor thing, that must be hard.
Yeah. When walking on 3 legs is hard enough, having this leg do that to her is an even bigger issue for her.
It's going to be impossible.
It's going to make it really hard. The best thing now is to take an X-ray.
Okay.
Now, an X-ray is going to tell us exactly what's happening structurally with this leg.
Righto.
We now know more about what's happening functionally, but once we know what's happening internally with the bones, then we then have all the information we need to make a judgment call on what we can do for that leg.
Okay.
Every single step here is revealing more and more about how Annika lives her life. But if she's going to live a happy life long term, we need a solution. And that solution ultimately revolves around what's happening on the inside of this leg. So are you okay if I take her through for an X-ray now?
Yeah, for sure.
And then I'll let you know exactly what we find.
Yeah, baby, be brave. You be brave. Let's go.
All right, thank you.
Thank you.
See you soon.
Bye. See you, Annie.
It's okay. There we go. Yep.
At the Bondi Clinic, Chris needs an X-ray of little Annika's front leg.
X-ray.
The 11-week-old Akita puppy was born with a horrible deformity that's affecting her quality of life.
Wow. Can't say I've ever seen an X-ray like this before. This forearm here, which is, you know, the equivalent of this on me, that should be about twice the length. And it's just not really going to its full distance. And these toes here, it's just essentially a little bag of bones. And looking at this X-ray really confirms that what we're looking at here is a deformity. There are a lot of different ways to interpret this result here. For me, it is a good thing. What we're seeing here is confirmation of what we've been essentially proving over the last few hours. So to me now, it's clear how we provide Annika with a bright future, how we can actually give her the rest of her life pain-free and full of happiness. There is only one answer. Hey, Rose. All right. So, to me, the easiest way to open up a future is quite simply to get rid of that leg.
Okay. Fair enough. Yeah. Yeah, I guess if that's what you think is going to be the right thing, that's all I want.
Yeah. There's no way of saving the leg. I think that's the thing to remember here. There's no way of putting sensation into a leg that has none.
Yeah.
There's no way of rebuilding a leg when the bones actually aren't there in the first place.
Fair enough.
And so that's where the challenge is. And the positive outlook here is the fact that she'll do brilliantly without this leg holding her back.
Yeah, it's really kind of overwhelming at the moment, but I know that this is the right thing and I've just got to stay strong for her.
Right.
Okay, thank you so much. Thank you.
No worries.
Thank you very much. Bye, Annie. You be a good girl.
See you soon.
Thank you.
You're going to be fine.
At the Bondi clinic, it's a huge day for Annika, with Chris preparing to remove the puppy's deformed front leg.
How's that feeling, little one?
It's been a rough road for the rescue pup, who was born with the debilitating problem.
My whole mission here is to really make sure that Annika's quality of life is improved and set her up what should be a happy future ahead. But that future won't be happy unless she can walk well.
All right, let's get started.
Vet nurse Lisa is assisting Chris with a difficult operation.
The challenge at the moment is really working my way down through the skin, through the muscle layers, past the blood vessels to where I need to actually go through the leg. Just getting to a collection of nerves and blood vessels here. They're only small, but they can still bleed, so we're just going to clamp those off before we cut them. How's she doing?
She's been stable the whole way through.
Okay.
Once Chris is safely through the layers of muscle, he can begin delicately severing the nerves in the top of the leg.
Normally when you cut through nerves like I'm doing now, you get a twitching down the leg. But as I'm cutting through these, nothing's actually happening. So it is further confirmation that for whatever reason, the nerve function to the bottom part of this leg just is non-existent. Okay, Annika. There we go.
Finally, the deformed leg is removed.
It's actually come off reasonably well. I mean, we've managed to preserve all those blood vessels. Those nerves, we've cut through those with no major problems. So now comes the next challenge. It's sewing all together. There you go, one suture to go. Okay, we are done. We're looking pretty good. It's like there was no leg there at all. Annika's come through that operation remarkably well. When you consider how young she is and still how small she is, losing a significant part of your body like that, it is going to take its toll. From here, she just has to rest overnight, and tomorrow morning we'll start to see the future Annika, the new Annika, and hopefully the happy Annika. There you go. You through the hardest part. You just need a good sleep now. Yeah. Hello again. Look at you, huh?
At the Bondi clinic, it's been just one day since Chris removed little Annika's badly deformed front leg.
You bounced back, haven't you?
The 11-week-old rescue pup is recovering remarkably well and is already wreaking havoc.
This just says it all, doesn't it? This? Yeah? And this, right? Yeah, it's been quite the night. Annika recovered quite quickly to the point where she was licking her suture line and then decided to chew her own drip out, which is why she's now wearing the cone of shame.
Good girl.
Here we go. We get to see now, don't we? Yeah? Look in the eyes and say, why did you do it? Because you can get away with it, that's why you did it. All right, let's have a look at this wound. Actually looking pretty good. We're not overly sore either, which is nice. I mean, it's going to be sensitive. So far, so good. I mean, she's bounced back remarkably well, and importantly, the area where we took the leg off looks healthy. All right, good progress. Although you and your tongue already knew that, didn't they? Every indication from Annika this morning is she's ready to go, but we need to see how this body performs. Annika, come here. Annika, come here. Come here, come here. Come here, come here. Oh, yes. Look at you go. This is the first time I've seen Annika run. Call her again.
Annika, come here, Papa. Come here, sweetie. Oh, you're so good.
You look at her face and it is full of delight. Suddenly, there's now so much to be excited about for Annika. And I know Rose is going to be desperate to see this. You ready for your moment? Yeah? Let's do it. Hey, Rose.
Yes?
Come out here.
Okay.
look at this.
Wow, I know. I haven't seen that tail move for a while. Seeing her run, there's just no words. My heart's just bursting. I was expecting to see her, you know, look like she was in some kind of pain, but true Annika form, she's fantastic. She's such a trooper.
So she's in pretty good shape.
Yeah.
And the wound looks good. It'll slowly flatten out and then really improve.
Righto.
All right, well, there's only one thing left to do.
Thank you so much.
And over to you.
Okay.
All right. All the best.
Thank you so much.
Very special to her.
Thank you. Thank you for everything.
No problem.
That's unreal. All right.
All right.
We'll keep you posted.
Please do.
Thank you.
I feel like I've got to know Annika so well, so quickly. And it's sad to see her go, but that sadness is really mixed with optimism because that personality of hers will go a long way with the right family. And I'm sure she'll find it.
Let's go find you a home, huh? Good girl. Let's go.